Welcome, everybody. Thank you for joining our Health Professions webinar this evening. You will hear from our faculty in the College of Health Professions at Pace University to learn more about the various career opportunities available with a lot of our different majors. My name is Liam Tui. I'm an undergraduate admissions counselor here at Pace University. I recruit in Manhattan as well as Long Island, so if you're from either of those areas and I've met you before, hello again. I'm joined by my colleague, Sarah Carton. She's also an admissions counselor. She works on the Pleasantville campus, and we will definitely be introduced to the rest of our faculty and staff tonight. Feel free to post your questions in the chat box throughout the webcast. After our presentation, we're actually gonna do a live Q&A session. So think of those questions throughout and we'll get to them after.
I'm Harriet Feldman. I'm Dean and Professor of the College of Health Professions in the Leonhardt School of Nursing. Senior Associate Dean Manival will be joining after me, and then after her, Associate Dean Belinda or Bo Anderson. So we're very pleased to be here and especially pleased that you're interested in hearing about careers in health professions. And this is a good reason why. It's one of 6 of the 10 fastest growing occupations are in healthcare. And this is from the Bureau of Labor Statistics. The average salary for nurses with a bachelor's degree in the area is almost $95,000. For professionals in health sciences job, it's over $82,000. And I can proudly say that 95% of our graduates are employed in jobs related to their field of study within 6 months of their graduating. We have terrific outcomes in all of our programs, including our retention rates. Our students like us, they stay, they do well, we give them a tremendous amount of support. I'm pleased to present Dr. Manival, who will talk a little bit about the nursing program.
Hello, everyone, and thank you so much for joining us this evening. As Harriet said, I'm Rhonda Manival, the Senior Associate Dean for the college and for the School of Nursing. And so if you come to PACE, you'll see a lot of me if you come to the nursing program particularly. So I want to really start this evening, my goal for a very short time period is to really talk to you about 2 things. And one is nursing as a career per se, a little bit about that, and nursing education at PACE. First, some information about PACE nursing, and you see, the information on the slide here. We are considered one of the top programs in the greater New York area, in the top 10% of the country. We have what's known as a direct admit nursing program, which, I think is really important, an important piece of information for students who are considering a bachelor's degree in nursing to really contemplate and evaluate. For us, if you're admitted directly into the nursing major. So that doesn't mean that you come in as pre-nursing and then at some later time you need to compete for actual seats in the program. When you come to us as a freshman, we're committed to you because you've committed to us, and we work hard to ensure that students are successful and complete the degree in 4 years. We also are very proud of our NCLEX RN pass rates. Those of you that are interested in nursing know what that means. That's the national examination that all nursing students upon graduation have to take in order to become registered nurses and to practice as nurses. Nursing, is an amazing career, right? Nursing is an amazing career. And, it's something that, I always want to make sure when someone is contemplating nursing is, why? Why is it that you want to be a nurse? What attracts you, to this particular major? And, often the response is that, I want to make a difference. I want to help people. And that's great because that's the perfect starting point for someone who is seeking this career. But the other piece of that is recognizing that it takes a lot of dedication and commitment to be successful. It is considered one of the most difficult undergraduate majors in the country. And so, it's something that you really need to come with the spirit of recognizing that, you're going to work hard when you're with us, but the payoff is going to be absolutely tremendous at the end of the day. One of the important aspects of becoming a registered nurse is all the amazing and evolving opportunities you have once you enter the profession. So you have this opportunity to keep reinventing yourself once you're a nurse. You could leave the program and decide that you're going to be an emergency room nurse or a critical care nurse or an orthopedic nurse or an operating room nurse. And then 10 years later or 5 years later, you might say, you know what, I would like to do a different type of nursing, and that's available to you. Or you might say to yourself, I would like to go back and be a nurse practitioner. Or maybe I would like to go back, and take additional certification education or different types of master's degrees in nursing to be a nurse informaticist, for example. And you could also go back and get your doctoral degree. Perhaps you would like to ultimately become a faculty member or be a nurse scientist. We actually have one of our baccalaureate graduates who also came back and received her master's degree from us and is going to complete her PhD degree this spring. And we could not be prouder of that. So in CHP Undergraduate Nursing, as I mentioned, students are admitted directly into the major, and students have their first nursing course in their freshman year, in the spring semester of their freshman year, and their first clinical courses beginning in their sophomore year. It's important to recognize that, when you're a nursing major, you have a lot of activities that you are doing related to your education. Not only going to class, which is very important, by the way, but also being scheduled to be in the simulation laboratory, being scheduled to be in the clinical site to actually go out under the direction of faculty and deliver direct care to patients. And keeping in mind that all of these things you have to schedule and plan for on top of studying, right? So you have a very, very busy schedule as a nursing student, but certainly one that is meaningful and that we're there to support you. Our motto is every student goes to the tutoring center, right? We are all being tutored all the time, and that's particularly true when you're, a nursing major. The other thing I did want to mention to you, and if you've been to any of our other events, you probably saw, the video of our simulation center, the Center for Excellence in Healthcare Simulation, which is, absolutely state of the art. So as a student, you'll get to spend a lot of time there practicing skills, but also practicing key aspects of being a nurse under the direction of faculty. So we have what are called standardized patients, where we have highly trained actors who will come in and play the part of a patient, in which you will do an assessment and you'll talk to that person and do various things. But we also have very high fidelity simulators, which are mannequins that breathe and their eyes blink and they have a blood pressure, and you can see, their heart rates on the monitor, and you can give them drugs and you can give them blood, etc. And many, many different types of task trainers. So, I really believe that we provide for students a very holistic education and one that meets every type of learner's need. Whether you learn best by doing things hands-on, we're there for you. If you think you learn best by talking and interacting with faculty, we do a lot of that as well. So please let us know if you have any questions for us. And I hope this has given you a good snapshot of what it would be like to be a nursing major at Pace. And I really hope to see you all in the fall. I would now like to introduce My co-conspirator here and fellow Associate Dean, Dr. Bo Anderson, who oversees all of the other allied health programs within the College of Health Professions. So Dr. Anderson.
Thanks very much, Dr. Manavelle, and welcome again and thank you very much for taking time out of your schedules to join us this evening. So Dr. Manavelle told you a lot about our undergraduate program in nursing, and I want to tell you about our undergraduate program in health science. So a lot of students coming in at this point as they're just starting their careers are often kind of wondering, I know I want to go into healthcare, but I'm not really sure exactly, which discipline of healthcare I would like to specialize in. And as you're probably aware, there are a lot of different choices these days. Anything from being a medical doctor, nursing that we've just heard about, and then a full range of other, what we call allied healthcare disciplines, such as occupational therapy, physician assistant, speech pathologist, physical therapist, chiropractor, and there's a full range. And these healthcare careers, unlike nursing, require you to do an undergraduate degree and then go into a graduate program to fulfill the requirements to get a license to practice in one of those healthcare disciplines. And so our health science program is designed to be the ideal type of program that would lead on to one of these graduate programs. And part of the reason why I describe it as the ideal program is because it covers a broad range of aspects of healthcare, which really give you the background knowledge that you need before you specialize in becoming a healthcare provider. So we're particularly interested in the College of Health Professions in what we call whole person health, which has become a very widely recognized approach to healthcare that greatly improves health outcomes. And what we really mean about this is that for a long, long time, we thought that people's health and wellness was really related to the things that were provided or given to them when they saw a healthcare provider. So, we typically think when you're sick, you go and see the doctor or you see a nurse practitioner, and they, examine you and then give you guidance as to how to address your particular healthcare issue. But we now realize that this is a very limited perspective on what is really involved in keeping people healthy and well. And in actual fact, we now recognize that a lot of things that happen outside of hospitals and healthcare clinics are significant contributors to people's health and wellness. So this can be anything from somebody's diet or the amount of exercise they're doing or not doing, the stress levels, their interpersonal relationships, their environment at home, their social network, their level of education and knowledge of how to keep themselves healthy and well, their economic situation. And all of these factors actually contribute more than the health that is provided in a typical healthcare setting like a hospital or a clinic. And so this is what we mean about whole person health, is within healthcare now we're recognizing that it's the whole person that we need to take into consideration. So body, mind, and spirit, the psycho-emotional aspects are equally as important as the physical aspects. So we've designed our program to focus on all of these different aspects that impact health and wellness. You can see that in addition to addressing whole person health, we provide the people that go through our program with a number of tracks or specializations that can lead seamlessly onto graduate level education and careers in different aspects of healthcare. So the generalist track has focused more on global health, and health policy and advocacy. So for those of you that are less familiar with that, I think the pandemic has really indicated the importance of public health. And we know that the pandemic has been a global healthcare issue, and that we're all, in a lot of ways, dependent on each other and the measures that we take to prevent the spread of infection, and to develop vaccines, to encourage people to have vaccines. And so we really can look at a lot of health issues on a global scale. And also we have to develop policies, both within our own countries, but also through organizations like the World Health Organization, to coordinate policies across different countries and help improve, or in the case of the pandemic, manage, major health challenges. So the generalist track leads on to careers that are more focused in that direction. And a lot of those careers don't require a graduate degree. So you can go straight from our bachelor's into those types of fields and have a very satisfying career in those lines of healthcare. The pre-nursing and the pre-physician assistant are leading to graduate level education. So for students that are either uncertain about whether nursing is their #1 choice, or were not able to get into the undergraduate degree in nursing, you can actually take the pre-nursing track in our health science undergraduate that leads right on to an accelerated program that will lead you to licensure in nursing. So it's like a second opportunity, if you like, to choose that career, should you decide that's really what you want to do. The physician assistant track obviously leads on to our graduate degree, our master's degree in physician assistant, but it's also the track that you would take if you're interested in doing graduate degrees in a number of other healthcare areas. For example, occupational therapy, physical therapy, nutrition and dietetics, speech language pathology, communication and speech disorders, and even careers like veterinary science, dentistry, pharmacy, and being a medical doctor. We have a very talented group of student advisors who will work closely with students on that pre-physician assistant track to make sure that they take all of the coursework that is required to get into their particular graduate healthcare program of choice. I just want to outline how these careers are very well paid. As you can see from the numbers that we've provided for you there, physician assistant average salary in New York State is well into the 6 figures. Same with occupational therapy. And then for registered dietitian, you can see their range is just a little under 75,000. So of course, if you go into healthcare, a lot of people are not necessarily motivated by their salary. They're more motivated, as Dr. Manavell said, about helping people. And so one of the most rewarding aspects of a career in healthcare, aside from the salary and the job security and the ease of getting a job, is job satisfaction. Knowing that you're really making a difference in people's lives, and really through your actions as a single person, you're contributing to the health, wellness, and happiness of a very large number of people. So we are going to open it up now for questions, and we'd love to hear from you, your feedback, your questions, and we'll be happy to answer those for you.
Great. Thank you so much. So again, hi, everyone. My name is Sarah Carton. I work in the Office of Undergraduate Admissions. So I will be managing the chat and asking our panel some questions and answers. So feel free to write any of those questions in the chat so we can get those answered for you. So we did have a few come in. So our first one is, are nursing students allowed to double major?
So I think I'll take that one. We certainly would support a nursing student taking a minor, but to double major, it would become very difficult once you enter and begin clinicals to find the time to actually double major, just the physical time to attend classes, et cetera, for that major. So, you know, the short answer to that question is it's really not possible with the nursing major.
Thank you. And we had some questions about going into the medical field. We have a student that may be interested in pursuing being a surgeon one day. So what do you find would be the best major to have that preparation for a graduate and doctoral degree?
I think there are two paths, one that Dr. Anderson can talk about, but there's also a pre-med track in the biology department in Dyson College. So that's one option, but certainly we have an option too.
Yes, well, I touched on that. So that would be the physician assistant track, but working very closely with the student advisors to ensure that you're taking the prerequisite courses that would be required to get into the medical school of your choice. That is a very prescribed number of prerequisite courses. And so if you really know that that's what you want to do, as Dr. Feldman mentioned, you might be well advised to look at both programs, both ours and the one in biology at Dyson College within Pace University.
And the biology program is going to be heavily science. That will be the main focus for pre-med.
So we have a few more questions in regards to nursing. So how many years is the nursing program and what is the job placement rate? And then if you could just go over the nursing requirements in terms of the passing grades in nursing. What GPA would you need to maintain?
Sure. So the nursing program is a 4-year degree. A traditional undergraduate student would progress from freshman, sophomore, junior to senior, taking 4 years during the academic year. The program does not run in the summer. Job placement rate, there is a extraordinarily high demand for nurses. Typically, as we track our placement rates as students respond to that, it's well into the 90%, about 92%. But we do know that if students are interested in working as a registered nurse, once they pass their licensure exam, there certainly are ample jobs for them to fill. And then the other question, remind me, Sarah, what was the third part of that?
In regards to maintaining good academic standing within the program.
So yes, you have to maintain an overall cumulative GPA of 2.75, but you must in each nursing major course and all of the major prerequisite courses, such as anatomy and physiology, microbiology, chemistry, the minimum grade to pass those courses and a nursing course is a C+.
And then I believe you did cover this on your slide, but we're being asked about starting salaries within nursing.
So certainly, if you in the greater New York area, that rate, is in the low to mid 80s to start. So that's in, urban areas. Depending on where you live, I think you should check, those local institutions, if you're looking to go back. We find that many of our students are planning to stay in New York after they graduate, and they are very much incentivized to do so by the larger employers in the area with many types of supplements, some with housing supplements, et cetera, to attract and maintain their nurses.
Great, thank you. And I think it would also be helpful if you were able to share some professional experiences or internships that students have participated in while working towards their degree.
Well, so the undergraduate nursing program has almost 800 direct clinical hours. So beginning in your sophomore year, you will be out in clinical sites, working under the direction of a faculty member, delivering care to patients. Many of our major partners, Memorial Sloan Kettering, Westchester Medical Center, Northwell Health, White Plains Hospital. The list goes on and on, offer what they call a summer externship program for nursing students. And so you would apply to those programs and they bring you on as a nurse extern. They pay you. It's usually a 12-week experience in the summer, 10 to 12-week experience in the summer where you actually work with a registered nurse and you provide care to patients under that nurse's direction, while in that facility. So those are wonderful experiences for students. And not only do you get the experience, the employer gets to say, hey, do we like this person? Will we want to hire them when they graduate? Do we want to keep them on during their senior year and allow them to work here? The other thing that I think is really important about our program is that in your last semester senior year, you have what is called a preceptorship experience. And that is where no longer will you have a nursing faculty member on the unit with you, but you will be assigned to a practicing registered nurse, and you will work with her on her shifts when she's there for a total of 135 hours that you will schedule with her as to when you will do those hours. And this is where you actually take on the role of the registered nurse under that nurse's direction, helping her care for her patients, giving medications, engaging in all aspects of patient care. And I would tell you, students find that to be an extraordinarily meaningful experience for them. And many of them end up being hired by the institutions in which they've had this precepted experience.
You may want to also mention the electives we have, the clinical electives for seniors.
Yes. So, something that we're very sensitive to is that, sometimes some students would like to have a little bit deeper dive from a didactic standpoint, but also a clinical standpoint in a particular specialty area. And so in collaboration with 3 of our major clinical partners, actually it's 4 at this point, major clinical partners, we have developed what we call the clinical elective. So as a nursing major, you have to do 1 3-credit elective course. And so students can choose to save that course for their last semester and choose one of those clinical electives. And they include psychiatric mental health nursing that we're doing with Metropolitan Hospital, neonatal intensive care nursing, which we're doing with Westchester Medical Center, oncology nursing with Memorial Sloan Kettering, and operating room nursing with New York Presbyterian Hospital. So you get to have this fantastic classroom experience where we actually bring the nurses from those areas in to teach the specialty, but then you get to do your 135-hour clinical experience in those facilities in that specialty. And I can tell you many students who do that end up being hired at those hospitals.
And are there any additional examples for students who may be pursuing the health science?
Well, many of the locations that Dr. Manavell mentioned are also utilized for our other graduate healthcare programs. So clinical placement, so students are going out to these locations and working side by side with the nurses, the physician assistants and the doctors, and really having that authentic experience is definitely part of the training. And we have, as Dr. Manavell mentioned, a lot of partners, both in New York City and Pleasantville, where we place our students for those components of their training.
We've also had students in the internships placed in non-healthcare settings. So for example, we've had people who work with legislators in public policy and health policy. So that's another avenue. Global health is another one, and working with some folks who are involved with the United Nations. And so there are lots of opportunities that are not health health institution related that students can take advantage of in the health science major.
Thank you so much. And we had a question in regards to transferring college credits or any dual enrollment during high school. So I can take that one. So if you have earned any dual enrollment credit through another university while in high school, any APs or IB credit, we do evaluate those for transfer credits. So you can be waived out of some of your PACE courses. For college credit, we will look for a grade of a C or higher. For APs, we look for a score of a 4 or higher, as well as for IBs. So if you do have any college credit, that's awesome. We will do the evaluation on the admission side of things. So just make sure you are getting us those transcripts and college board reports when you are committing to PACE, so that we can do those evaluations for you.
Well, I see there's a lot of questions in the chat box from Stephanie. And I've been reading those with great interest. Stephanie, it seems that you're a little bit torn, maybe, that you want to go to medical school, but you've got these other interests, and I would say you're uncertain as to how compatible they are to lead to getting to medical school. And I would say maybe, Sarah might be able to advise you better than I can, but with these kind of broad range of interests, it might be, a little more challenging to get a direct path to medical school. But my advice would be to explore these various interests so that you wind up in a career that is really well matched for where your interests lie. So, you've mentioned psychology and philosophy, and actually it sounds like a great match for our undergraduate health science degree, but that may not be the most direct path to medical school. So this is something that I would encourage you to think, deeply about and seek out advice. We're more than happy, to help you in more detail, to find the path that's right for you.
And you might be able to double major. It's really going to depend on what those majors are to know if they're manageable.
Absolutely. And I've also written my contact information in the chat. So if you are kind of switching between majors at the moment and kind of thinking in different areas, but you want to pursue a healthcare career, just reach out to me. I would be more than happy to schedule a one-on-one appointment with you to really discuss your options. And then just know that it is fairly easy to switch your major prior to enrolling at PACE. So if you want to talk about those career options, we can definitely go over that. And then we have a question from Destiny. Is there anything we have to do over the summer to apply for these programs? So you have been admitted to PACE underneath either bio or health science. So if you did want to switch your major, again, I wrote my contact information in the chat. We can talk about what major you would like to pursue here at PACE. Okay, we have a question about our accelerated nursing program and what it is like.
Accelerated.
So very accelerated. Very accelerated.
So, the accelerated nursing program basically is a second bachelor's degree. So you complete your bachelor's degree in health science, and during that time, you have taken all of the necessary science courses and prerequisite courses that allow you to move into this accelerated Bachelor of Science in Nursing program. So basically what we do is we accept all the components from your first bachelor's degree, your bachelor's in health science. And now what is left is for you to do 50 credits of nursing. And you will complete, and it's only nursing, and you complete those credits in 3 semesters. So if you were, let's say, you applied to and you wanted to enter the accelerated bachelor's program on the Pleasantville campus, that means that you would go spring semester, summer semester, and fall semester and graduate in the fall semester. We tell students that you really cannot work while doing this major, because as you can understand, think of all those clinical hours I've already spoken about with the traditional four-year program. You're going to be doing many of those same numbers of hours and those same amount of time in the simulation lab, etc. And so, so you really need to be available for school, 5 days a week. And, there's a lot of studying. It's an intense major. But what I've always found with the accelerated program, which I think is also true for the traditional four-year program, is there's this spirit of the cohort. So, students are very tightly knit together. They support one another, lots of study groups, lots of cheerleading between them. And I'd also tell you, we have an amazing and supportive faculty and infrastructure for tutoring and support for students. So, our motto is, if we've accepted you into the major, we're going to support you, and we are dedicated to seeing you complete. So, don't be scared off. Do the house science first, and by the time you finish that, you will be ready for that challenge.
I might add to that, and there's also a nuance in terms of physician assistant, and that is that you need to maintain a 2.75 in order to get into the accelerated program. So you'd have to graduate your health science degree with that. For a physician assistant, it would be a 3.0. That is a graduate program you'd be going into rather than an undergraduate program. So the standards are a bit different.
Sarah, I just wanted to add, if anyone does have questions about the accelerated nursing program or any of our other graduate programs, like some of the ones we've mentioned tonight, physician assistant, nutrition, communication sciences and disorders. I see a question about physical therapy. Although we don't have physical therapy, we do offer occupational therapy. I'm going to put my contact information in the chat. You can always send me an email, and we can also schedule a virtual appointment to do more one-on-one counseling, because we find that that's pretty important during the advisement process as you're looking to complete all of these prereqs that are required.
And then we have a question from Destiny that says, what types of jobs would fit well with the regular undergraduate health science program or nursing program? I think they're referring to any outside jobs, talking about outside commitments and being able to manage the workload.
Well, definitely jobs that allow you to have flexibility. If you can, get work done in your own time, then that's the most ideal situation. Minimizing commuting time to your job, unless that's also a good study time, like you're on the subway and you can be reading your notes and that sort of thing, then that's helpful. But if you have to drive and it's a big commute, that's going to consume a lot of your time. And jobs that are very exhausting, so very physically, active or very exhausting. You don't want to be falling asleep in class. That can sometimes happen with people who do a lot of work. And then just fitting your actual classes around your work schedule. So, that flexibility, of course, is going to help. But if you've got fixed days where you have to be at work, then fitting all your classes in on the other days, could be more challenging.
And for nursing, for certain, you have to really limit those hours for work because it is so challenging. And there are so many hours in the program. It's as in terms of the clinical, for example, you may have a 3-credit course, but that's 9 hours then of clinical time. So it's not a matter of 1-for-1 as it is in the classroom. You have to build that kind of thing in and realize once you're in the clinical years, that's going to be the most difficult in terms of the amount of time that you need to devote to your courses as well as studying. And even as a freshman, I'm thinking you're taking the heavy science courses, so you really need to get that pinned down and understood before you can be taking the other courses. The better grounded you are, the better you'll do in your nursing courses.
Yeah, the general rule of thumb for homework is for every hour that you're in class, you should be allowing 2 hours for preparation and homework. So that can enable you to be able to calculate the total number of hours that you'll need each week to do your studies.
Absolutely. So what would you find are the major differences between pursuing a health science bachelor's or going with the biology route?
Well, the biology degree is very focused on what we call the basic sciences. So obviously a lot of biology and related courses, biochemistry, molecular biology, chemistry. So these are more looking at the basic mechanisms of how living organisms function and how physiological processes work. As compared to health science, which is more about, it's more the big picture. So we're not so much interested in the deep chemistry and biochemistry of the body, but we're interested in health and wellness from a broader perspective. We're interested in the role that governments play and defining healthcare policy, how, global health and the interactions of different countries. We're interested in more the sort of psychosocial aspects of health and wellness. So it's a much broader perspective on health and healthcare as compared to the more science-focused, which is looking at, at the human body. How does it work? What are the components? What is the chemistry that's going on? And how do we manipulate that with all sorts of interventions like pharmaceutical drugs, with surgery, with genetically engineered therapeutics? How does that all work? So it's more kind of mechanistically focused.
Amazing, thank you. And then we do have a last question about going into dental school.
Yes, well, once again, dental school, it's very similar to medical school. So health science undergrad could be a pathway. You'd want to also look at the biology degree in Dyson. That might be a more direct path. So I think it's tricky if you really are passionate about, being a medical doctor, a veterinary physician, or a dentist. Arguably, the most direct path is to take more of the basic science-focused undergraduate degree. But for a lot of people, they get more value out of taking a more health science, broader focused undergraduate degree. However, that may require you to take some courses to get into the graduate level program that you didn't have in your undergraduate degree. So it could require some additional study to meet all of those prerequisites. The other thing I really want to emphasize is that different institutions have different requirements in terms of getting into the graduate level healthcare programs. And so what is really helpful, if possible, is if you know which programs or which institutions you want to get into, and then you can work directly with the student advisors, really focusing in on that particular program and their prerequisites to make sure that you have undertaken all of those while you're at pace doing your undergraduate degree.
I would also say that would include, for example, looking at medical schools to see what do they require for acceptance. I would think they're pretty similar from one school to the other, and take a look at 2 or 3 just to get a sample, and that will give you a much better indication of what kind of degree might work best for you prior to applying for medical school.
And also the GPA.
Yes.
Really, these are very competitive. Schools are competitive about this. So, whether you're doing health science, whether you're doing PA, accelerated nursing, occupational therapy, all of those different ones, it can become very competitive. So you really want to make sure that, when you take these science courses, that, you are really dedicated to doing well in them.
I have one other idea that I'm thinking about, and that is that we now have a public health minor, which can be taken while you're taking either nursing or health science. And we are also working on a Master of Public Health. It's a couple of years away, but by the time you graduate, it certainly should be up and running. And so for those of you who take the minor and or the health science program might very well transition at that point to the graduate program in public health. That's another pathway to think about.
And maybe mention health informatics.
Yeah.
Yes, we're starting that soon, yes, too. So, and in your health science program, you are getting some courses in not telehealth, in informatics, in computer science. And so that'll give you a flavor of it as well.
Yes, for those of you that are wondering what healthcare informatics is, it's you know, you might think old computers, but it's more than that. It's all these devices, these Fitbits and wearables that everybody's using now. So it's the way in which all that information gets analyzed. It's also artificial intelligence. So we're developing what we call machine learning now. So instead of physicians looking at X-rays, for example, machines can look at those and make interpretations. And in actual fact, it's now known that the machines do a much better job than the people. And so, for example, there's a new technique called retinal screening, where they look at the small part of your eye, which is the retina, and machines can detect not just whether you've got eye-related problems, but whether you've got other types of problems like high blood pressure, or, you know, a tendency towards problems with your heart function. And so we're going to see an enormous development in this field in the future, and looking at huge volumes of data that come in through the electronic health records, and being able to understand trends across populations that we never could before. So it's kind of an exploding field, and we're developing a master's degree that will be available by the time you graduate from the undergraduate degree.
Yeah, it's the intersection of health and technology. And yes, the degree should be up and running well before you graduate.
So I think we are winding down with our questions. Just to reiterate, so if you have any questions about your intended major, or you're kind of in between your area, but you know you want to go into the health professions, please feel free to contact me at any point and we can set up a one-on-one appointment. And if you do have interest in our graduate programs, Justin McManus has put his contact information in the chat as well. We want to thank you so much for attending tonight. We hope that this has convinced you to not only become a pace setter, but also to pursue a career within the health professions. We will be sending you a goodie in the mail, so we will be sure to take down all of our attendees tonight. But again, thank you so much for attending. We really appreciate it, and we hope you have a great rest of your night.
Thank you.
Good
Bye,
night.
everyone.
Stay safe, everybody.